me take your time real quick. The current class is about PTSD. A lot of people know about it, but they don't know too much in depth about it. PTSD is an anxiety disorder that many soldiers have when they return from war or some traumatic happened to them. Not everyone will develop PTSD. A lot of people learn how to cope with it and know how to cope with it, but there is lots of soldiers out there who do not know how to cope with it or deal with it. It is known as shell shock or battle fatigue. It can happen to anyone, but many soldiers do not get it once again. They do not test PTSD because many soldiers know how to cope with it, and many do not, or many do not speak up about it. Many soldiers, civilians, and family members who are victims to PTSD can develop it as well. They develop it because they have so much going on in their lives, and then they have that soldier that come home, and then they have to deal with that soldier and the many other things that happen. The symptoms of PTSD fall into 3 categories: reliving the event, every night having nightmares, avoidance of anything that may remind the person of the event, like the one situation when we came back and a truck backfired and first sergeant disappeared. Another symptom is increased arousal, including excessive emotion problems relating to others, difficulty falling or staying asleep, outbursts of anger, difficulty concentrating, and maybe jumping. Once the symptoms have been recognized, it is best to take the person to medical personnel or sit down and try to have them talk it out. Because there are no lab tests to determine if a soldier has PTSD, he or she will have to go through a process so they can successfully be diagnosed as having PTSD. The process will consist of them going to a doctor and having the doctor basically do a full exam or a medical history. He or she is then sent to a psychologist or a mental health expert who will then diagnose them with PTSD. They will then use a specially designed interview and assessment for PTSD to determine you have it. The American Psychotic Association has the criteria for PTSD that must be met in the Diagnostic and Statistical Manual of Mental Disorders. If you do not meet it, they will not say you have it. Treatments for PTSD may include psychotherapy or medication, and in some cases both. Depressive medication, antipsychotics, and anti-anxiety meds are just 3 meds that are usually to treat PTSD. There is another med, but they highly recommend that PTSD soldiers do not use it because they don't really know if it helps PTSD, but it does help with some of the side effects of having PTSD. Therapy is used in PTSD to help soldiers talk or revisit the nightmare again and again. They are now using a technology that will take you back to the event that happened safely, and they will let you relive that event until you can honestly say, okay, I can go through this event every day and I'll be okay with it. Not getting treatment for PTSD can be a lifetime misery for that soldier. Coping with PTSD is hard enough, and soldiers are more likely to not seek help if they know that their chain of command may think they are weak for doing so. Lots of soldiers, even a soldier I talked with who is in my class, has said that a lot of soldiers are scared to go to their chain of command because your chain of command, most infantry chain of command think they are weak or something is wrong, or they go about and they announce it the wrong way. So there are more likely cases of soldiers with PTSD who may be thought of having behavior problems, but they're not having behavior problems, they're having PTSD symptoms, but they're too scared to go to their chain of command and talk about it. The summary is: first, we learned about what PTSD was and who it affects. Secondly, we learned the process of getting the diagnosis.